Good afternoon and welcome. I'm excited to be here with all of you today for the Class of 2022 Student Clinician Ceremony. Students, today we recognize your accomplishments. We reflect together on what it means to be a medical professional, and we think to the future as you transition to the next stage in your journey of becoming a doctor. I would like to start off this afternoon by expressing gratitude to the many who have made this day possible. To Dean Reese, thank you for being with us and for your ongoing support. To all the faculty and those who are here today to witness this group of students take their own oaths of professionalism, thank you for your commitment to education, your passion for teaching and mentorship, and your dedication to your patients and the field of medicine. You inspire me, and I'm lucky to work with you, as are our students. To the students' family and friends who may be viewing today's events from home, thank you for sharing your loved ones with us, for encouraging them and supporting them through the ups and downs of medical school. I should then also make sure to thank our Office of Medical Education, specifically Mr. Kevin Brown and Mr. Kamraj Gransom, for coordinating today's live stream presentation, making that home viewing possible. I would like to acknowledge and thank Mr. Larry Pitroff and the Medical Alumni Association, along with the Gold Humanism Honor Society, for partnering with us to send each of the students a professionalism pin to be used during today's ceremony. And thank you to the GHHS students for writing and sending each student in the class of 2022 a note welcoming them to clerkships. I'm sure that simple gesture is appreciated more than you know. Today would not be possible without our hosts from GHHS. So thank you, Drs. Goyle and Levin, the GHHS faculty advisors, and thank you, student co-presidents, Molly Himmelrich and Ellen Moore. Finally, a special thank you to Ms. Kristen McCartan. We're grateful for your excellent organizational skills and event planning expertise, not to mention your adaptability to the current times. Class of 2022. Today marks your transition into the advanced clinical phases of your training. From the anatomy lab, the library, the lecture halls, with a quick detour through dedicated, of course, and on to the patient's bedside. In a few short weeks, you will be joining care teams, working among other healthcare professionals, and contributing directly to the health and care of others. Patients and families will look to you as their doctor. You will provide comfort, a listening ear, and a healing touch as you navigate the patient-physician relationship. And while this moment alone marks a momentous time in your personal journeys, your entry into doctoring is also marked by a historic pandemic, one that has affected all of us in some way, but has also highlighted existing disparities in our healthcare system, and as well by a call to action in our communities against the injustice and racism plaguing Black men, women, and children, our colleagues, friends, neighbors, and our patients. Your careers will be marked by these historic challenges, the likes of which many of us have never faced. The road ahead will be difficult. Change is never easy, but necessary. Your willingness and compassion are what is needed to help move us forward. While the challenges you face may be hard, they are worth the effort. And I look to the words of Ms. Obama to encourage you. You will not always be able to solve all of the world's problems, but don't ever underestimate the importance you can have, because history has shown us that courage can be contagious and hope can take on a life of its own. Knowing that you are joining our team gives me hope for a better future. Your courage is contagious. At this time, we will break from our usual program to recognize the historic meaning of this particular day, June 19th. In light of current events, it is perhaps a happy, hopeful coincidence that today's ceremony honoring this profession of medicine and welcoming you as you transition to clerkships and a more active role in the care of patients, that this day would coincide with Juneteenth. At this time, I would like to welcome 3 students from the class of 2022, Erica Makar, Nita Gombakamba, and Melina Howard, to introduce and recite a poem in recognition and celebration of Juneteenth. Erica?
On June 19, we celebrate the ending of slavery in the United States, a day known as Juneteenth. While the Emancipation Proclamation enacted on January 1st, 1863, stated that all enslaved persons in the states were free, it wasn't until June 19th, 1865, over 2 years later, that Union soldiers, led by Major General Gordon Granger, landed at Galveston, Texas, with news that the war had ended and that the enslaved were now free. To commemorate this wonderful occasion, we'd like to share a poem entitled Juneteenth, written by Arthur Kroll.
January 1st, 1863 was the official day for President Lincoln's Emancipation Proclamation. But it was 2.5 years later before the start of the Freedom Celebration. Many attempts were made to explain this delay. It has remained one of the great mysteries until this day. One story says the messenger of freedom was murdered on his way to Texas. This was supposedly the first one of the conspiracy theory nexus. Another one reports the landowners censored the news to maintain their labor force. One of the more popular stories, but who was the source? Yet another tale of federal troops allowing another harvest of cotton. Of all of the dirty tricks, this one was the most rotten. Regardless of whether any stories give the correct news, many good people in Texas remained without freedom and singing the blues. Finally, in June of 1865, Major General Gordon Granger, with a flag and a gun, stormed the shores of a Texas town called Galveston. The general's first order of business was to announce the news of freedom. And this time he brought along enough Union troops to make the people heed them.
Some people reacted with shock, while others reacted with complete jubilation. The news of this day finally spread all over the nation. Most people could not wait to leave the plantation and start living free, so from their home state they started to flee. Regardless of where they went, they were followed with freedom's challenges. These challenges came from making decisions and environmental changes. They never forgot the joyous 19th day of June, when people once enslaved could finally sing their freedom tune. The celebration started with reassuring and praying. The adults were eating and drinking while the children were playing. It was also a time for the reuniting of family members. It was one of the happiest days many of them remembers. Today, it is a day of pilgrimage to that town. Let the shouts of freedom for all make a holy sound. Soon the day will come when in unison we say, forever and ever, all Americans will celebrate Juneteenth, the freedom holiday.
Thanks so much for sharing that, Erica, Nita, and Melina. I'm Molly, one of the co-presidents, along with Ellen, of the Gold Humanism Honor Society. Now we will hear remarks from Dean E. Albert Reese, Executive Vice President for Medical Affairs at the University of Maryland, Baltimore, John Z. and Akiko K. Bowers, Distinguished Professor, and Dean of the University of Maryland School of Medicine.
Students, you are now prepared, and I'm sure excited, eager, and perhaps a little nervous as you enter the next season of your medical career. After 2 challenging years in the classroom, the last small portion of which was actually virtual, you will soon have the chance to join the front line and employ the abilities and the skills that you have learned thus far. It's unfortunate that we cannot conduct this special ceremony in person, but let this virtual format serve as a reminder of the value that you bring to the clinical setting, and that which you could not be entering at a more critical time in our history. Especially now in this pandemic season, you will rapidly learn the new skills during your 3rd year of medical school. As a father of modern medicine, William Osler once said, and I quote him, "The good physician treats the disease. The great physicians treat the patient who has the disease," unquote. I challenge you always to remember the human being who is behind the disease. When we prioritize the patient over pain, we help our patients see well beyond the current state of affairs. Make no mistake, our deportment impacts the treatment that we provide. One of the most significant ways that we can fulfill our role as physicians is to maintain a positive, upbeat attitude. The cornerstone attributes of being a physician capture this attribute in 3 C's: caring, compassionate, and committed. This is what I hope you will learn as you enter the clinical years. You have all received your professionalism pins for your white coat today. As you begin this next phase of your medical education, we want you to revise the oath taken during your white coat ceremony and recommit to the promises you made at the time. The pin will serve as a constant reminder of your commitment to your patients as well as to your profession. Please do not ever forget the tremendous responsibility you have to your patients. The manner in which you practice your medicine today will determine the nation's quality of health for tomorrow. In closing, let me leave you with this charge. Achieve honor, achieve integrity, achieve selflessness in your own relentless pursuit of excellence every day. Good luck to you in your 3rd year and 4th year of clinical care of patients. Thank you.
Thank you, Dean Reese, for those remarks, and as always, for your support. I next have the honor of introducing our keynote speaker for this event, Dr. Neil Reynolds. Dr. Reynolds is an associate professor of medicine at the University of Maryland and co-director of the multi-trauma ICU at R. Adams Crowley Shock Trauma Center. He was born and raised in Maryland and received both his undergraduate and medical degree at the University of Maryland. He completed training in internal medicine and critical care and began working at shock trauma in 1987, where he has remained for a majority of his career. He helped establish the first ECMO and CRRT programs here and is highly regarded for his outstanding contributions to critical care medicine. Students from our Gold Humanism Honor Society class nominated Dr. Reynolds for this lecture because of his lifelong practice of humanistic principles in medicine, as well as his true passion for medical student education. He has been a preceptor for ICM1 for the last 8 years, and students from our class have said that, quote, Dr. Reynolds was the best preceptor they've had in medical school. One student also said, I attribute most of my clinical skills to his teachings. Year after year, he is honored for excellence in teaching and most recently was nominated as the Critical Care Attending of the Year at Shock Trauma for the 3rd time. He is also known among students for his respect for patients, their dignity, and their time. Dr. Reynolds has committed himself to providing high-level care for underserved patients in Baltimore, and he has been a strong believer in the power of telemedicine long before the surge of telehealth we're seeing now. He's used this technology to reach patients with little or no access to healthcare. We think that his perspective is particularly important during these unprecedented times because of his extensive experience working with marginalized populations and long history of innovation in the field of critical care medicine. He is currently virtually on the front lines of patient care, driving robots around the critical care ward in the shock trauma ICU to visit with his patients and speak with their families. His storied career could be described in a lecture series in and of itself, so I'll have to stop myself there. And without further ado, I would like to thank Dr. Reynolds for being here to speak with us and turn the floor over to him.
Well, Ellen, thank you very much. I'm awed. Am I speaking loud enough? I hope so. I am an intensivist at the R. Adams Cali Shock Trauma. So that means I deal with machines and devices and technology and biochemistry, monitors, internal, external. And we make a lot of numbers. We reduce our patients to numbers sometimes. Yet this real, everyday life and death environment is earthy, it's personal, it's gritty, it's close and painful. It's packed with everyday human experiences. So I hope I have something to share with you. So I'm a graduate of this medical school. I entered my third year, are you ready? 1974. And some of you are doing quick calculations. That's 46 years ago. None of you were born then. And perhaps some of your parents weren't even born then. And yes, I'm a grandfather. So there. The CTs and the MRIs were not even fantasized at that point. And we all carried, as medical students, little black bags. And in fact, I drug out my black bag. It looks like this. None of you have seen anything like that, except Dr. Tom. So a lot has been changing. However, humanism is one of the things that's really never changed. It's forever rock solid. And when you listen to lectures on humanism, you don't take notes. There are no notes to take. There are no little mnemonics, no little jingles, nothing like mud pies for acidosis. It's all about human experiences. So what an honor to be able to talk to the class of 2022 and to share some of my thoughts with clinicians of tomorrow. And I'm going to be talking about humanism, the same stuff your parents taught you, nothing more. So I've got a few bullets here. Honesty and engagement. You know, your patients will not expect you to be perfect, nor will your parents. Yes, your patients imagine that you're the best doctor, or at least hope so. But what they really want is somebody who's honest and committed. You heard Dr. Dean Reese talk about commitment. They want patients, they want you to own their problem. So you own your patients. That's my patient, I say. Defend your patients. They want to feel that you care, and you're going to be conscientious, and you're going to be thorough. You can share your uncertainties with them. You can discuss the road you're traveling, as uncertain as it may be. Diagnostic mistakes you will make, Yoda would say. Some of those mistakes are going to be terrible. You just have to move on. But be direct, and having laid the foundation of honesty and uncertainty, they will still own you. They will say things like, my doctor said this. Sometimes you're going to have nothing other than just plain stark honesty to offer your patients. And you'll probably actually get more praise than you think you deserve just for being honest. Get to know your patients. Get to know your patients. Get to know your computer. Ask your patients, ask the family, what do they like to be called? There are surprising nicknames out there, and it's okay. I don't feel comfortable using that nickname, but you got to know them. Ask them where they're from. You might share a common knowledge of the area. Ask them what they do or what they want to do. Look at the pictures the families bring in. Ask them questions about those pictures. Families know it's good for their loved ones to be known by the medical staff. We get invested when we know them. Recognize your patient's strengths. Try to determine where they get that strength from. You know, it's generally from family or some future goal. I have a story. I have a lot of stories. Here's one. Streptococcal septic shock can be devastating. Strangely, I have a small cadre of patients in a club that you never want to be part of. 5 patients. All have lost all 4 extremities. Can you imagine? One man lived through dark times. He got his strength from a little dynamo wife. I swear his wife was 3 feet tall, but 9 feet tall. And from his son, and a shared addiction for baseball. A young woman that we got to know well. Young, she was 35 or so. And I remember a quote, and here it is. She lost her hands and her feet. And she said to me, my life is different. That's all. I have 3 children. And that's all she said. It was clear where she got her strength. So I've had the good luck to know a woman. She's on the internet, well known to our institution, lost all 4 extremities, probably one of the country's most functional 4 extremity amputee. She's got bioprosthetics, all 4. She travels around the country. Can you imagine going through the airports and so forth? At any rate, where she gets her strength, I have no idea. But maybe it's from all the people that she helps. So remember patients and their families. And these people, I marvel at every single one of them. Be a doctor. Everybody here knows the Latin word docere, teacher. Teach your patients and their families, not all at once. You know, none of you could read Harrison's textbook. I don't even know if you read it anymore. At any rate, it's a book. It's about that thick. You can't expect them to read the whole thing. You wouldn't tell them everything at once. But I have several rules in critical care, and maybe they apply in life in general. And maybe they help people with their day-to-day reality. Remember, patients and families are thinking the worst. So here goes. Rule number 1. When things are going well, they never go perfect. Things go like this. So then I tell them it takes longer than you think. I know Dave Gens is in the audience, and he'll look at our patients and he'll say, that person will be here 3 or 4 months. Our patients are there a long time. Another rule I tell them is when you look back years from now, this will seem short compared to the rest of your life. And then I tell them, if you think things are hard now, you just wait until you start feeling better. Teach them in a way that gives them hope and balances their reality. You're going to be counseling. You're going to be counseling a lot of people. Intensivists and oncologists do a lot of end-of-life counseling, and I thought I'd share some of my approaches, perhaps not perfect. If time permits, sometimes it's not appropriate, but if it permits, I ask them, tell me about your loved one, your mother, father. What's she do? What do they want to do? Do they read books? They enjoy television, grandchildren? They feed themselves? They go shopping? Please don't make assumptions about age. We all look older and frailer when we're sick in bed. When appropriate, ask the patient or the family or the significant other, have they thought about end of life? And you can see my focus here is in people approaching end of life. Have they shared their desires and goals? Living wills and advance directives are just basic legal boilerplate. They don't help very much. What you want to get is that shared, priceless communication between the patient and some other family member. Then you'll really know what they want. So here's some homework for you, soon to be third year students. I want you to learn about the end of life of Ronald Reagan and Pope John Paul. These are life stories that are very valuable tools. And I share these stories, the end of life portion of their life, with patients routinely. But back on to the discussion. Give your patients clear recommendations. You're going to be the experts. Give them your opinion directly. Laying out a long litany of alternatives can be baffling. The family may have little experience with death and dying. And by the way, they may reject your recommendations. It's okay. It's not about you. It's not personal. Just agree to continue to do the discussions and do so. Deliver bad news directly. When death is inevitable, say so. Long dissertations before getting to the bottom line is confusing. Arrive quickly to the bottom line and then be silent and let the family, the patients, the family ask questions. Don't lose them in techno speak. Myocardial infarction doesn't work. Heart attack works. I want to talk briefly about faith and illness. One of the underserved hospitals I worked at is a faith-based hospital across town, and they taught me a lot. Don't be afraid to ask the family or the patient if they're a person of faith. Remember, the majority of our population is spiritual. You don't need to be a minister or even faithful, just respectful. Pastoral services really are a specialty service. Get their consultations. They are experts also. And don't be hurt when somebody says, we believe in God and you're not God. Well, you actually know that. You didn't need to be told. You just continue to educate and counsel with your best judgment. There are traps out there, many I'm sure. I'm going to tell you about one of them, and stories. Don't be prey to the common statement, she, he, they wouldn't want to live that way. This may come from your medical colleagues. It may come from the family. When coming from your colleagues, kind of what they're saying is, you're doing too much, or you should let them die. Certainly nobody wants to live with a disability. Nobody. This is always true. Having a disability and not wanting to live are far different. I'm going to tell you quickly about Christopher Reeves. Do you remember him, Superman? He had an equestrian accident. He came down, landed straight on his head, broke his neck at C1. He was an immediate C1 quadriplegic. He either had the good or bad luck. Somebody in the audience came down and breathed for him, kept him alive. He didn't want to live that way, but he served our country very well for 9 more years, strongly supporting spinal cord research. But that's not always true. Sometimes patients don't want to live, and it's legitimate and appropriate. But be good for your word, and I'm going to tell you another story. Strangely, in the time that Christopher Reeves had his injury, I had another patient, but older, exact same injury, exact same events. Somebody saved his life, so to speak. He came to me. This patient did not want to live. I bargained hard with him to give himself 30 days of life. He did. 30 days and about 1 minute later, his wife called back and said, he's ready to be let go. We brought him back to shock trauma, and I helped him through the last hours of his life. That was my part of the bargain. He was my patient. That was many years ago. Don't let these machines interfere with your patient relationships. In some real ways, computers have led to an unforgivable barrier between you and your patients. Patients hate you talking to your computer. Turn around, face them. Arrange your office ergonomically so you face your patient. You know, I think it's okay to politely cuss at your computer. The patients can relate to that. But most of all, you are the technology generation. Dream up less intrusive ways and make it happen. Telehealth, as Ellen mentioned, what a great tool to democratize medicine, to reduce inequalities. During this COVID-19 event, I do now drive a robot around in the ICU to care for patients. It's unique. I roll into the room and patients smile at me. And some actually think I'm inside that robot. I'm not. But in the blink of an eye, pretty quick, it's Dr. Robot and a patient. They adapt stunningly quick. And I do Zoom, somewhat like this. Zoom videos with families. I've delivered updates. I've delivered bad news, end-of-life counseling. But you know, I did a conference not long ago where I was here at Shock Trauma. Actually, I was home, I believe. At any rate, the family was on their front porch. And virtually, I was in a place that they were very comfortable with. And you know, I think that actually worked better than having them here at the hospital in one of these sterile rooms. So you can make technology work, maybe even better than face-to-face or whatever. So I do remember technology, triumphs, great therapeutic interventions, extraordinary saves, and I know you'll engage in lively debates about technology. You'll have all sorts of numbers and share them. Humanism, that is honesty, engagement, commitment, responsibility, respect for differences, will give you the human interactions that will stay for you for your whole career. You'll develop special ways to help your patient, and that's what it's all about, helping your patients. It's really that simple. And you will, in fact, be that best doctor your patients want. Well, I hope some of these thoughts may make you more confident as you go through your clinical years. And I wish you all the best. Thank you for listening.
I wanted to thank Dr. Reynolds for sharing those beautiful remarks. And I'd like to congratulate the students for reaching this important milestone in your medical training. This is a very exciting day. We wish we could be here in person, but we're so glad to be here virtually. So I'd like to invite the students to change to gallery view so that you may all see each other during the pinning of the presentation of the pinning. I'll give you a moment to get in gallery view. That's at the top right of your screen. And I'd like to invite all of the students now to place the pins, which they've received from our Office of Medical Education, onto the lapel of your white coat, or if you don't have a white coat, onto your shirt. This is normally a time when we would be pinning each other. So if you do have a family member or friend, you're welcome to have your loved ones place the pin. If not, you can place it yourself. Unmute the participants so that you can hear each other.
Awesome. So, Tilly, on the screen.
All right, congratulations, students.
Here,
so in a moment, we're going to recite together the Hippocratic Oath. I'd like to invite you all to change your monitor to speaker view. Okay, so we're going to recite together responsively, and Ellen and Molly will join me for the recitation of the student clinician oath. As I begin this next stage of my medical career,
As I begin the next stage
of my medical education, and to serve them with integrity.
I pledge to act in the best interests of my patients
and to serve them with integrity, compassion, and respect for their beliefs and circumstances.
And to serve them with integrity, compassion, and respect for their beliefs and circumstances.
In doing so, I will remember the warmth, empathy, and the art of medicine are as vital to scientific knowledge to the care I provide.
In doing so, I will remember that warmth, empathy, and the art of medicine is vital
to scientific knowledge, care I provide as a healer, educator, and advocate.
As an educator, healer, and advocate.
As a healer, educator, and advocate.
To these goals, I dedicate myself in the honorable traditions of the School of Medicine.
To these goals, I dedicate myself
to honorable traditions of the School of Medicine.
Thank you and congratulations to all of our medical students. I'd like to invite Dr. Tom to give some closing remarks.
Thank you, Dr. Levin, and thank you to everyone that made this day possible. Dr. Reynolds, thanks again for sharing those stories with us today. Your thoughts on humanism were so on point to me. In particular, your ideas around honesty, developing relationships, and really getting to know our patients, not just who they are, but what they are looking for and what they want, so that we can best support them and advocate for them. Simply just being there for our patients when they need it. These are excellent reminders for our students as they are about to enter clerkships. Students, thank you for all the hard work you've put into this point. I feel lifted and inspired today about what's to come next. I truly cannot wait to see you on the wards in just a few short weeks. You've heard in the chat box, the faculty, the teams, and the patients are waiting for you. Class of 2021, welcome to third year.